Hi, everyone, and welcome to the World Doc Allen podcast. I'm excited to welcome to the program, World Doc Allen, Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil, and you?
Fantastic. Today's topic, pregnancy in the emergency room. How do pregnant women wind up in the ER?
Well, there are several ways. I would say the most common would be miscarriage, and that would be associated with bleeding, pain, and passing of tissue. There's also ectopic pregnancy when the pregnancy is most often in the tube, but there's recently been a pregnancy that went to 33 weeks in the abdomen. They don't do that very often, but they can do it. Also, sometimes you can treat ectopic pregnancy with methotrexate. This should all be done by an obstetrician or a gynecologist. Women also present with pelvic infections, and those are hard to diagnose because they come on slowly, and it's difficult always to know or even recognize that you have that. Then there's trouble with baby moving. If you think your baby isn't moving enough, the best thing to do is go to labor and delivery. The emergency room is not the right place. If you do go to the emergency room, those doctors should send you to labor and delivery. Sometimes, though, women get something as simple as a pulmonary embolus, and that's a blood clot that goes to the lungs. They present with pain. It can be in the front of the chest, it could be in the back, it could be all over. But the thing that really is important to recognize here is that there's shortness of breath, so you have to ask that question. It's diagnosed with a CT angio, which will show the endometriosis.
Should you use an OB/GYN doctor in the emergency room?
Well, I think so. Years ago, we were required to go to the emergency room when there was any kind of female difficulty. As a matter of fact, the ER doctors were also required to call us. So I think it's a very important thing to call an obstetrician. And, there is such a thing for the most part now as hospitalist OB/GYNs. They are there to deliver all the babies that come in within a day. So they're around, so they should be called.
Should you have follow-up with an OB/GYN?
Yes, I believe it's really important. And I think, like in the second question, that should start when the patient comes in. They shouldn't leave the emergency room without having an appointment to follow up with an obstetrician or a gynecologist.
All right, the best place to go is worlddocallen.com and pick up Pregnancy Away today, available on Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the World Doc Allen podcast. Take care.